Well, doctors say testing could be a key to stopping the spread of COVID-19.
But if you want to get tested in Minnesota, it is not easy and limited to groups like hospital patients and healthcare workers. Why is that, and how might it change? Good question. Heather Brown explains what our labs are missing.
Over 1 million Americans have now been tested.
As of this morning, the U.S. has tested 0.3% of our population for COVID-19. South Korea has tested 0.8.
That compared to other countries, the U.S. is behind.
Here in Minnesota, we've tested about 22,000 people, 40% in the public health lab and the rest in other labs like Mayo, the U of M, Hennepin Healthcare, and a private company, LabCorp. That's about 1 out of every 250 Minnesotans. It's better than more than half the states, but less than New York, where they've tested 1 in every 88 residents.
No one is anywhere near where we are.
We are aware that vendors are allocating more of their resources to those hotspots.
In Minnesota, the Department of Health has asked providers to prioritize testing to healthcare workers, hospital patients, or those in group living facilities like nursing homes. The reason? Limited testing supplies.
In anticipation of a surge, we need to make sure that we are good stewards of the resources that we have currently because we know they're limited. So it's really important to test those populations that matter in terms of how we can make a difference in tracking exposures and treating the patients that we have who are in our hospitals.
The chemicals or reagents used in the labs and the swabs to get the samples are in short supply. That's a major source of frustration for the governor, who has repeatedly asked the feds for supplies.
Not a single governor is not fretting over trying to get this testing regimen up because of understanding how critical it's going to be as we come through this first waves.
A new quick test has been approved by the FDA.
The first priority as we roll out is our frontline workers.
Nationwide, 6 private labs are scaling up their testing. Mayo is too. But the health department still says it doesn't see a time yet where any Minnesotan who wants a test can get one. Heather Brown, WCCO 4 News.
This week, the FDA issued its first emergency use authorization for a coronavirus antibody test. It is a blood test. It would identify past infections, but would be less effective at diagnosing current cases. If you have a good question for Heather, record a quick video and send it to her through WCCO.com/links.